Good evening, everyone. Good evening, everyone. I am Megha Bhatnagar, and I'm currently pursuing Masters in Biotechnology from SRM University, Chennai. And I'll be presenting the role of microRNA 186.5p in regulation of placental inflammation via inflammasome activation in GDM. GDM, or gestational diabetes mellitus, is a common metabolic disorder in which women develop high blood glucose levels during their pregnancy. About 20 to 40% of these pregnancies have placental inflammation. Placental inflammation is caused by NEK7, that is NEMA-related kinase 7, which is also an inflammasome activator. Now, inflammasomes are multi-protein complexes, for example, NLRP1 and NLRP3, which leads to the activation of pro-inflammatory cytokines. These pro-inflammatory cytokines further lead to a cascade of inflammatory responses. But inflammasome activation is tightly regulated by post-transcriptional modulation via miRNA. miRNA or microRNAs are small non-coding RNA sequences which regulate the gene expressions and also inhibit protein synthesis. But the precise role of NEK7 in GDM and its potential interaction with the inflammasomes remains largely unexplored at the molecular level. So this gave a hypothesis that NEK7 targeting microRNAs may regulate placental inflammation via upregulation of inflammasomes in gestational diabetes mellitus. To fulfill this hypothesis, the objectives that we performed were to investigate the mRNA expression profiles of inflammasomes and inflammatory cytokines in placental samples from women with GDM, then, to examine the mRNA and protein expression levels of NEK7 in placental tissues from GDM and healthy pregnancies and its mRNA expression in vivo cells. Further, we identified potential microRNAs regulating NEK7 using an in silico approach. Finally, we validated the selected microRNA through mRNA expression analysis and assess its correlation with NEK7 expression in GDM placental samples and vivo cells. So the methodology included we collected 25 placental samples from healthy pregnant women and 25 placental samples from pregnant women with gestational diabetes mellitus. After collecting the placental samples, we went for NEK7 expression analysis where we analyzed protein expression and mRNA expression using Western blot and qPCR. Further, we did the mRNA expression analysis of inflammatory cytokines and inflammasomes. We then did the in silico analysis to screen the microRNAs that are predicted to target NEK7. Further, we did the mRNA expression analysis of the selected microRNA and observed its correlation with NEK7. We then used BO cell line, which is a placental derived tropoblastic cell line that is commonly used as a model to study the placental functions. We treated this BO cell line with high glucose and then did the mRNA expression analysis using qPCR. These are the clinical and biochemical parameters that were collected and recorded by SRM Medical Hospital. And these include fasting glucose, BMI, postparental glucose, HOMA-IR, HbA1c, and so on. So moving on to the results, we obtained the gene expression analysis, wherein we obtained that the gene expression analysis of pro-inflammatory cytokines TNF alpha, IL-18, IL-1 beta and IL-6 were significantly upregulated in the GDM placental samples in comparison to the normal healthy placental samples. Since inflammasomes produce pro-inflammatory cytokines, we observed the gene expression analysis of inflammasomes, and here also we observed a significant upregulation in the gene expressions of NLRP1 and NLRP3 inflammasomes in the GDM placental group in comparison to the normal healthy placental samples. We then observed the correlation between inflammasomes and inflammatory cytokine using Pearson correlation, wherein we observed a significant positive correlation between them. We then did the expression analysis of NEK7 in the placental tissues and observed that the mRNA expression as well as the protein expressions of NEK7 were significantly upregulated in the GDM placental group in comparison to the normal healthy placental samples. Upon observing the correlation of NEK7 with the biochemical parameters as well as with inflammasomes, we observed a significant positive correlation. Here, positive correlation means that if NEK7 expression is increased, the inflammasome expression will also be increased. Then we did the screening of microRNAs that are predicted to target NEK7 using in silico analysis, wherein we utilized 4 softwares that gave a list of miRNAs, and further we scrutinized these microRNAs based on the target scores above 90%. This resulted in 15 miRNAs, out of which microRNA 186.5p had the highest differential expression in the placental tissues based on the MITED software. So we then analyzed the mRNA expression analysis of microRNA 186.5p in the placental tissue. And interestingly, we observed that there is a significant downregulation of microRNA 186.5p in the GDM placental samples in comparison to the normal healthy placental samples. Upon observing the interaction of microRNA 186.5p with NEK7, we observed a significant negative correlation between them as well as a strong binding between them. So to validate our result, we utilized BO cell line. Here also we observed that the expression of NEK7 was overexpressed while the expression of microRNA 186.5p was downregulated. Here also we observed a significant negative correlation between them. So this concluded that microRNA 186.5p regulates inflammasomes by targeting NEK7, playing a role in inflammation and progression of GDM. A strong negative correlation exists between NEK7 and microRNA 186.5p in pregnant women with GDM as well as in BO cells under hyperglycemic condition. So we can say that whenever the expression of microRNA 186.5p, which was earlier downregulated, if we overexpress it in the GDM patients, the expression of NEK7 will be downregulated. And since NEK7 is an inflammasome activator, it will lead to the reduction of expression of inflammasomes NLRP1 and NLRP3. This will automatically lead to the reduction of pro-inflammatory cytokine expression, leading to reduced inflammation. Hence, microRNA 186.5p could be a potential therapeutic target for reducing inflammasome expression and regulating inflammation in GDM progression. I am grateful to Dr. Anuradha ma'am, Dr. K. M. Ramkumar sir and SRM Institute for helping me in the research study, and these are the references. Thank you.